This pharmacology topic is penicillin antibiotics. Penicillins are a commonly used class of antibiotics which work by blocking the formation of the bacterial cell wall. Without a cell wall, the bacteria has no supporting structure, so it will eventually break down and die. Now, penicillins are part of a broader class of antibiotics known as beta-lactam antibiotics, which are all characterized by the presence of a beta-lactam ring in their chemical structure. Medications in the penicillin class are easy to identify as they all end in "cillin", such as amoxicillin, ampicillin, nafcillin, penicillin G, penicillin V, and piperacillin. To remember how this class works, think the cillins are killing by inhibiting synthesis of cell walls. Now, you've probably seen penicillins used before, maybe even taken one yourself, as they can target multiple strains of bacteria which cause several common infections. They're often used to treat infections caused by gram-positive bacteria, including streptococci and staphylococci. Examples of these infections include strep throat, skin and soft tissue infections, some respiratory tract infections, including pneumonia, as well as ear, nose, and throat infections. Some specific penicillins will also cover a wide range of gram-negative bacteria, including E. coli and Klebsiella, which allows them to be useful for treatment of urinary tract infections. Penicillin is also the drug of choice for treatment of syphilis, which is a sexually transmitted infection. And finally, penicillins are often used for prophylaxis in some clients prior to surgical or dental procedures, given their coverage of the common bugs that are found in the skin and in the mouth. Now, as important as it is to know what penicillins do treat, you should also be familiar with what they do not treat. Namely, they have no activity against methicillin-resistant Staphylococcus aureus, also known as MRSA, or atypical organisms. So they should not be used to treat infections caused by these bugs. Now let's move on to adverse effects. One of the most commonly reported allergies is to penicillins, and the way this allergic reaction can present can vary widely from person to person. Some clients may have a reaction that's localized to the skin, while others can have a more severe systemic reaction, such as anaphylactic shock. Now, for those skin reactions, the degree of severity can range from just a mild rash, as seen in the image here, to a more severe cutaneous reaction, such as Stevens-Johnson syndrome. This syndrome involves a detachment and loss of skin similar to a severe burn and can be life-threatening. Because these are all immune-mediated hypersensitivity reactions triggered by the chemical structure of penicillins, clients who have a history of an allergic reaction to any penicillin should avoid all other medications in this class, as a similar reaction can occur. It's important to get a detailed history of their previous experience and symptoms of the reaction, as sometimes clients may inadvertently consider other adverse effects as an allergy. One adverse effect that is sometimes misinterpreted as an allergy is gastrointestinal upset. Like most antibiotics, penicillin can disrupt the bacterial flora in the gut, which can cause symptoms such as diarrhea and abdominal pain. In some clients, this disruption in gut flora can lead to overgrowth of other pathogens. So essentially, in an attempt to treat one infection, the use of antibiotics can lead to the development of a new infection or a superinfection, such as Clostridioides difficile, which can lead to C. diff-associated diarrhea and colitis. This disruption in the regular bacterial flora can also cause overgrowth of the yeast Candida, which can lead to vaginitis or oral thrush. And finally, penicillins may reduce the effectiveness of oral contraceptives. Again, this is also related to the disruption in gut flora, which interrupts the process needed for absorption of estrogen into the blood. This will decrease serum levels of the contraceptive and potentially lead to loss of efficacy. Now, you may have seen that some of the drugs in this class are sometimes combined with another agent, such as amoxicillin with clavulanate or piperacillin with tazobactam. And the reason for this is antibiotic resistance. Over time, with the use of antibiotics, the bacteria that is being targeted may develop a mechanism to prevent being killed by the antibiotic. For penicillin specifically, some bacteria may produce an enzyme called beta-lactamase. Remember earlier, I mentioned that penicillins contain a beta-lactam ring in their chemical structure. Beta-lactamase is produced by the bacteria to break apart that beta-lactam ring before the penicillin can work. So essentially, the antibiotic is killed before it can kill the bacteria. Because of this, many penicillins are combined with beta-lactamase inhibitors, such as clavulanate and tazobactam. These will block that beta-lactamase enzyme, which allows the antibiotic to preserve its efficacy against the bacteria. Because penicillins have the potential to decrease the efficacy of oral contraceptives, clients should be taught to use a backup method of non-hormonal contraception while taking the antibiotic. Clients should be taught to report signs of an allergic reaction, such as hives, rash, or difficulty breathing, to their healthcare provider immediately. Clients should also monitor their initial signs of infection to ensure that the antibiotic is working. Clients can look for things such as a reduction in fever, pain, and inflammation, as well as improved appetite. As we discussed before, because antibiotics can disrupt the natural microbiome of the body, clients should monitor for signs of superinfection, such as diarrhea and changes in vaginal discharge. And finally, there are several things clients can do to help prevent antibiotic resistance. For one, they should finish their treatment course as prescribed, even if symptoms subside, as this will help ensure all infectious bacteria are sufficiently eliminated. And secondly, they should avoid sharing their antibiotics with anyone else and discard any extra medication rather than saving it for a future illness. This is because inappropriate antibiotic use can lead to the development of resistance, so it's vital that clients only take antibiotics which are prescribed to them for that specific illness.